Welcome everyone. My name is Sonia from Empower School of Health. We will be starting the event as per the schedule. Please bear with us. We will be waiting for a few more minutes, so we have a good number of participation. In the meanwhile, I would request speakers to please check with your mic.
Hi, this is Prof. Andy, just checking that we are good on audio and video too.
Yes, Prof.
Okay, that's good.
Good morning, this is Mashan.
Good afternoon, Professor Andy. How are you? This is Rahul.
Good morning. Good, doing well, and greetings, Mesfan. Yes, we can hear you well.
Good morning, this is Kidu.
Hi, Kidu. Yes, you're coming across loud and clear.
Good morning, Mr. Kidu.
How are you? Good morning.
Good morning, this is Nagacho. Can you hear me?
Yes, coming across clear.
Good morning, this is Heran. Can you hear me?
Yes, Aaron can hear you well.
Thank you.
Good morning, all. This is Zalalam.
Zalalam, yes, can hear you clearly.
Mr. Kido and Mr. Mesafin, please let us know when we can start the event. As of now, we have 17 participants.
Asman, can you hear Sonia?
Yes, Mr. Kido.
Asman,
Yes, Kido.
shall we start or wait some more minutes?
I think it is better to start so that those who join will not wait for me.
So Sonia, you can proceed.
Thank you everyone for joining today's meeting. My name is Sonia and I'm from Empower School of Health. I would like to introduce Mr. Mesafin, who can just take in the flow from here. Mr. Mesafin, if you can just continue with it.
Okay, good morning, everybody. I would like to welcome you to this ninth Antimicrobial Resistance Day organized by Ethiopian Pharmaceutical Association in collaboration with Empower School of Public Health, Ethiopian Ministry of Health, Ethiopian Food and Drug Administration, and development partners as well. And this is hosted for the ninth time in Ethiopia with the leadership of Ethiopian Pharmaceutical Association. And the whole purpose of this session is to promote the proper and the rational use of antimicrobials so that the public will be benefited from it and protected from unwanted effect of antimicrobial resistance. As you know, antimicrobial resistance is a serious threat and a public health concern. And beside increment in morbidity and mortality, it's also associated with high economic cost. So nationally, there is an antimicrobial stewardship with all stakeholders under the coordination of Ministry of Health and the Ethiopian Food and Drug Administration development partners. So EPA has been very successful in promoting the appropriate use of these antimicrobial microbials for the last 8 years. And antimicrobial stewardship, as we know, is to contain the proper the spread of this antimicrobial resistance, which currently require a concerted effort from all stakeholders besides the health sector. So before I will proceed to our today's session. I would like to thank all who contributed to the realization of this today's event. Empower School of Public Health, Ministry of Health, Ethiopian Food and Drug Administration, and our usual collaborators, WHO, Chemonix, and USAID. So thank you so much, and let me proceed to our today's session. We will have a keynote speech from Empower School of Public Health, followed by another keynote speech from Ministry of Health, and then we'll proceed to an opening speech. And following that, we'll have 3 consecutive presentations by our panelists, and then a discussion will follow. So we will conclude this session at 12 noon. So I would like to invite Power School of Public Health to give us their keynote speech. The floor is yours. Thank you. Anyone from Power, please continue. Sonia, can you hear me?
Hello, am I audible?
Yeah, you are audible.
Yeah, so thank you, Mr. Mesfin and Dr. Kidu for, I'm Rahul Sharma. I'm from Empower School of Health. I'm heading the Partnerships and Innovations Division here. And it is our pleasure to have a partnership with Ethiopian Pharmaceutical Association. And as an event to, improve the partnership and do something for Ethiopian Pharmaceutical Association, we are organizing this AMR Day event with the EPA along with Ministry of Health and Food and Drug Administration Authority. And I'll welcome all the participants on behalf of Empower School of Health for being a part of this event. And thank you, Dr. Kedu. Thank you, Mr. Mesfin, for giving us a chance to be a partner for this event. So over to Mr. Mesfin for the next part.
Thank you so much. The next speaker will be Dr. Apoxama. He is a Director General from Medical Service of Ministry of Health. The floor is yours, Dr. Apo.
Thank you very much, Masvan, for the introduction. Can you hear me? Am I audible?
Yes, we can.
Thank you very much for organizing such a very timely and very nice program. So I would love to thank the Ethiopian Pharmaceutical Association and all other personnel involved in the preparation of this program, with the theme Antimicrobial Stewardship Program in the era of COVID-19. So I'm here to make a speech as in many purposes. I'm the national chair for the Antimicrobial Advisory Team. I'm also currently leading the COVID case management, the clinical practice for COVID in the nation. So that I can really make few points regarding antimicrobial resistance in the era of COVID-19. Just to give you a few background information, here in Ethiopia, we have done literally, we've identified as like very few. It's as low as 10% of the patients have developed secondary infection, either bacterial, fungal, or prescription and the administration of antibiotics. Almost near to 80 or 78% of those patients have been administered antibiotics. So so you can imagine how rampant irrational use of antibiotics is currently, especially in the era of COVID-19, when patients have been admitted in COVID-19 hospitals while they are in more than 2-3 antibiotics without really confirming having a secondary infection. So this is a very critical finding in our setup. Even globally published articles, there are researches done in China, Wuhan, I think published in Lancet. I've seen still the rate of antibiotic administration is as high as 50% without really confirmed secondary and infection in fungal or any other bacterial infection. So this tells us that in the era of COVID-19, strengthening hospital antimicrobial stewardship program is very critical, and also making health professionals, especially prescribers, on board about antimicrobial resistance and rationalism of drug is a very critical and a very important aspect during COVID-19 and also before as well. So here in the ministry, we are trying all our best to strengthening antimicrobial stewardship program in the nation, starting from policy framing and also policy development. So I think majority of you have information that we have in the final stage of endorsing the National 5-Year Antimicrobial Resistance Strategic Plan. So hospital stewardship program, especially antimicrobial stewardship program, being one of the most important initiatives that's listed in the antimicrobial resistance strategy, and also antimicrobial resistance containment and prevention program by itself is one of the priority area for health sector transformation, and transformation plan 2 is already well explained in the health sector transformation plan 2 and during the costing and during activity lifting. So this is also another policy frame that really would help us in the coming years and months to strengthening the antimicrobial resistance and containment program in the country. At the same time, we for the past 1 year, we're trying to expand antimicrobial resistance of the program in more hospitals. Our plan was to reach most of the general and specialized hospitals that are able to reach 60 hospitals throughout the nation, and we have been providing continuous quality improvement aspects, continuous trainings, and also capacity building programs, data capturing, and also targeted support supervision, mentorship, and coaching for those hospitals. And we've really learned a lot from those antimicrobial resistance stewardship program, implementing hospitals, how we should reframe our national program in the years to come. So a program like this, especially having national specific antimicrobial day, and also celebrating World Antimicrobial Week in the coming 3 months. So it can help us to create awareness at policy maker level, at technical and facility level, and at the same time, even at community level. Communities are very important stakeholders during antimicrobial resistance prevention, containment, and also rationalism of drug. So such kind of programs, especially Antimicrobial Day, that's dedicated for the nation, is very critical. I think we need to work very hard to make that this day is more visible, more vibrant across the professional groups, across the health facilities, and also across the community. So I hope the Ethiopian Pharmaceutical Association will have programs, schedules to create more awareness on antimicrobial resistance and more awareness on the day, especially this national day. Apart from this virtual meeting and technical discussions, I think we need to have some innovative programs to reach the community, to reach the facilities, and also wider professional groups, so that everyone will be with us during the prevention and containment of antimicrobial resistance. So thank you very much for the invitation, and also thank you very much for the facilitation of this program. Even though we are stakeholders and we are also primary responsible body to make sure that people are safe, protected from antimicrobial resistance, but the contribution of the Ethiopian Pharmaceutical Association is commendable, and I really appreciate on behalf of the Ministry of Health. Thank you, Musfin, and I'm very happy to be part of this meeting too.
Thank you very much, Dr. Eko, for highlighting those key initiatives and your point to make this platform more visible to benefit more from it. And we are also very grateful to have you with us today on this session. Thank you very much again. Next, I will proceed to Mr. Hiran Garba, Director General of Ethiopian Food and Drug Authority. Ms. Hiran, it's your turn.
Thank you, Masfin. Good morning to you all. Am I audible? Can you hear me?
Yes.
Yes.
Okay. Thank you very much. Unfortunately, I'm very sorry. My opening speech is, I have prepared my opening speech in Amharic. So I don't want to bother you in translating it here because I might miss the most important point. So I will continue in Amharic. I hope this session is being recorded. So my colleagues who cannot hear Amharic could get the translation. አቶ ያዕቆብ ሰማን በጤና ሚኒስቴር የሜዲካል ሰርቪስ ዋና ዳይሬክተር፣ አቶ መስፍን ጉጂ የኢትዮጵያ ፋርማሲ ማህበር ፕሬዝዳንት፣ እዚህ ተሳታፊዎች፣ ጥሪ የተደረገላችሁ ከተለያየ ተቋማት የተገኛችሁ ተሳታፊዎች፣ በቅድሚያ የጤና ሚኒስቴር፣ የኢትዮጵያ ምግብ መድኃኒት ባለስልጣን፣ የኢትዮጵያ ፋርማሲ ማህበር እና የተለያዩ አጋር አካላት በመተባበር የ9ኛውን የአንቲማይክሮቢያል ሬዚስታንስ ቀን Antimicrobial Stewardship in the era of COVID-19 በሚል መሪ ቃል እየተከበረ ባለበት የመክፈቻ ንግግር ለማድረግ በመጋበዜና በመገኘቴ በጣም ደስ ብሎኛል። ይሄ በጣም ወሳኝ የሆነ መድረክ ስለሆነ እንግዲህ ያው የጸረ ተዋሲያን መድኃኒቶች በሰው ልጅ ታሪክ ለመቀየር ወይም ተአምራዊ መድኃኒቶችን በመባል የሚታወቁ መድኃኒቶች የሚሊዮኑ ህዝቦችን ህይወት ታድገዋል። ይሄም ሆነ ምክንያት ተዋሲያኑ እየተላመዷቸው አይበገሬ የሆኑ እየገፉ ያሉበት ሁኔታ ነው ያለው። ይሄም የዓለም ስጋት ሆኗል። እንደው ለምሳሌ ያህል ለመጥቀስ ፔኒሲሊንስ በ1943 እንደ አውሮፓውያን አቆጣጠር ዴቨሎፕ ተደርገው ወይም ደግሞ ተፈልስፈው ወደ ጥቅም ላይ ውለው በ4 ዓመት ውስጥ ሬዚስታንስ ተፈጥሯል። ሌሎቹንም ግሩፖች ብናይ በየጊዜው በ2 ዓመት ወይ በ3 ዓመት በ4 ዓመት ውስጥ ወደ ሬዚስታንስ ወይም ወደ ብግርነት እየተቀየሩ ይገኛሉ። በጣም አስደንጋጩ ነገር ደግሞ እንደ አውሮፓውያን አቆጣጠር ከ1987 ወዲህ አዲስ ክላስ ኦፍ አንቲባዮቲክስ ወይም የጸረ ተዋሲያን መድኃኒቶች አዲስ ነገር ዴቨሎፕ አልተደረገም። አዳዲስ መድኃኒቶች መጥተዋል፣ ግን መጀመሪያ ከነበሩት ክላስ ወይ ፔኒሲሊንስ ይሆናሉ ወይ ሴፋሎስፖሪንስ ይሆናሉ። ከዛ ውጪ ያሉ ሌሎች አዳዲስ ነገሮች ግን እየተፈጠሩ አይደለም። ይሄ በጣም አሳሳቢ ነው። ከረጅም ጊዜ የብግርነት ጉዳይ በረጅም ጊዜም የታወቀ ጉዳይ ቢሆንም አዲስ ነገር ባይሆንም ግን በጣም መዘናጋት ስላለ አሁን በዓለም አቀፍም በአገር አቀፍም ደረጃ ትኩረት ተሰጥቶት ዛሬውን እርምጃ ካልወሰድን ነገን መሻገር አዳጋች ነው በሚል ነው አክሽን ቱዴይ ኖ ኪውር ቱሞሮ በሚል መርህ አገራት ርብርብ እያደረጉ ነው። ፕሮጀክት የሚደረገውም ከ2050 በኋላ እንደ አውሮፓውያን አቆጣጠር ወደ አሁን እስከ 700,000 ሰው በአመት ይሞታል ወይም ህይወቱን ያጣል በሚል ቢቀመጥም ከ2050 በኋላ ግን በ10 ሚሊዮኖች የሚቆጠሩ ህዝብ በዚህ ጉዳይ ላይ ህይወቱን ያጣል የሚል ፕሮጀክሽኖች አሉ። አዳዲስ አንቲባዮቲኮችም ወይም ጸረ ተዋሲያንም ዴቨሎፕ እየተደረጉ ቢሆንም ቅድም እንዳልኩት አዳዲስ አይነት የአንቲባዮቲክ አይነቶች ወይም የጸረ ተዋሲያን መድኃኒቶች እየመጡ ስላልሆነ በጣም ወደ ፖስት አንቲባዮቲክ ኤራ ወይም ደግሞ ከአንቲባዮቲክ በፊት ወደ ነበረው ፔሪድ እንሸጋገራለን እና በጣም በቀላሉ ወደ ፈውስ የሚመጡ በሽታዎች ሁሉ ገዳይ ይሆናሉ እና የሚል ፕሮጀክሽን አለ። ስታቲክ ነው የዴቨሎፕመንቱም ጉዳይ የፍቃድ አሰጣጡም ጉዳይ አዳዲስ ነገሮች እየመጡ ስላልሆነ በጣም አስደንጋጭ ነው። ይሄ ጉዳይ ትልቅ ትኩረት ልንሰጠው የሚገባ ነው ለማለት ነው። እንግዲህ እንደ ሀገርም ኢትዮጵያ ቀድሞ ትኩረት ከሰጡት ሀገራት አንዷ ነች። ከዚህ ቀደምም ያው ስትራቴጂክ ፕላን ነበረን። ከብዙ አፍሪካ ሀገራት ቀድመን ነው ይሄን ፕላን ያዘጋጀነው። እሱን ተከትለን አንዳንድ ስራዎችን ለመስራት ተሞክሯል። ጥረቶችም ነበሩ። በተለይ ደግሞ የጸረ ተዋሲያን መድኃኒቶች በጀርሞች መላመድን መከላከልን መቆጣጠር ስትራቴጂ ማዘጋጀትና መከለስ ላይ አምስቱ ስትራቴጂክ ዓላማዎች ላይ ስትራቴጂው ላይ የተቀመጡት ላይ በተለይ ግንዛቤን አዌርነስ ለመፍጠር ጥናቶችን የተለያዩ ሰርቬላንስ ዳታዎችን ከመስራት አንፃር የኢንፌክሽን ፕሪቬንሽን ስራዎች በጤና ተቋማት ላይ እየተሰሩ ያሉት ቅድም ያዕቆብም የገለጻቸው የአግባብ አጠቃቀም ስቲዋርድሺፕ መመሪያዎችንም ሌሎቹንም ከማዘጋጀት አንፃር ጥሩ ስራዎች ተሰርተዋል። ግን ስቲል ካለው ችግር አንፃር ስናየው ግን በጣም ብዙ ስራዎች መሰራት መቻል አለባቸው። በተለይ ደግሞ በዋን ሄልዝ አፕሮች የእንስሳትንም የሰውንም ጤና መሰረት አድርጎ በጋራ ቀናይቶ እና የብዙ ሴክተሮችን ርብርብ የሚጠይቅ በመሆኑ በዛ ደረጃ ላይ ከመስራት አንፃር በጣም ብዙ ይቀረናል። ከ60 እስከ 80% የሚሆነው በሽታ አሁንም ተላላፊ ወይም ኮሚኒኬብል የሆኑ በሽታዎች ናቸው። የሰውና የእንስሳት ጤና አጠባበቅ ላይ የተሟላ ስራ ለመስራቱ የቁጥጥር ስርዓቱ የተጠናከረ አለመሆን በተለያዩ ወቅታዊ ጉዳዮች አሁን ወረርሽኙንም የኮቪድ-19ንም ከአግሪካልቸር ላይ ያሉትንም ጉዳዮች የሴኩሪቲም ጉዳይ በተለያየ ምክንያት ስለሚስበን ለዚህ ጉዳይ እየሰጠን ያለነው አትኩሮት አሁንም ቢሆን እንደሚጠበቀው አይደለም እና ይሄንንም ቀን ስናስብ እንደው ትኩረታችንን እንዴት ሰብሰብ አድርገን በዚህ ጉዳይ ላይ ተረባርበን ችግሩን እናቃላለን የሚለው ላይ በደንብ መታየት መነጋገር መታሰብ ያለበት ጉዳይ ነው። እንግዲህ በአጠቃላይ በኢትዮጵያ ምግብ ባለስልጣን የተጣለበትን ከፍተኛ ኃላፊነት ከግምት ውስጥ በማስገባት የተለያዩ ተግባራትን እያከናወንን ያለን ቢሆንም በአዲሱ በተለይ በ10 ዓመት ስትራቴጂክ እቅድ ላይም በተለያዩ ስትራቴጂክ አቅጣጫዎቻችን ላይ የአንቲማይክሮቢያል ሬዚስታንስ ጉዳይ ትኩረት እንዲሰጠው ከማድረግ አንፃር የተቀመጡ ስትራቴጂክ ዳይሬክሽኖችም አሉ። በተለይ ደግሞ አሁን ከኮቪድ-19 ጋራም ተያይዞ ቅድም ያዕቆብም ሲጠቅሰው እንደነበረው በተለያየ ምክንያት ችግሩ በቫይረስ የሚመነጭ ቢሆንም ግን በተለያየ ምክንያት አስፈልጎም ይሁን ሳያስፈልግም በተለይ መጀመሪያ ላይ በነበረው ድንጋጤ ጋር ተያይዞ በጣም ብዙ አንቲባዮቲኮች የጸረ ተዋሲያን መድኃኒቶች ታዘዙ ነበረ እና ይሄ የበለጠ ችግሩን የበለጠ ያባብሰዋል። አዳዲስ ነገሮች እየመጡ አይደሉም ያሉትንም በጣም ኤክስቴንሲቭሊ እየተጠቀምናቸው ነው ያለነው። የስቲዋርድሺፕን ከማስፈንም አንፃር ብዙ መስራት አለብን እና ከዚህ አንፃር ከወረርሽኙም ጋር መያያዙ የራሱ የሆነ ትልቅ ትክክለኛም ነው። በዚህ ወቅትም በጣም ብዙ ስራዎችን በተለይ ከግንዛቤም አንፃር በጣም ህብረተሰቡንም ከማስገንዘብ አንፃር ለጤና ተቋማት ላይም ላሉ ባለሙያዎች በደንብ ስልጠና አቅም የመገንቢያ ስልጠናዎችንም ከመስራት አንፃር አግባቢ የመድኃኒት አጠቃቀምም መመሪያው እንዲተገበር ከማድረግ አንፃር በጣም ብዙ ስራዎችን መስራት ያስፈልጋል። እንግዲህ ይሄ ምክክር መድረክ የተዘጋጀው የጸረ ተዋሲያን መድኃኒቶች በጀርሞች መላመድና መከላከልና መቆጣጠር ለመቅረፍ በተዘጋጀው ስትራቴጂ መሰረት ግንዛቤ ለማሳደግ ከሚደረጉ ጥረቶች አንዱ ነው። በየአመቱ ይሄን የምናደርገው ግንዛቤ እንዲፈጠር በዚህ ጉዳይ ላይ ትኩረት እንዲያገኝ ለማድረግ ነው። ስትራቴጂውም ሆነ ወረርሽኙ ዘርፈ ብዙ ሆኑ የተለያዩ መንግስታዊና መንግስታዊ ያልሆኑ አጋር አካላትና ህብረተሰብ ተቀናይቶ መስራትን ይጠይቃል። ይሄ ወቅት ደግሞ የቀጣዩን የ2014 በጀት ዓመት እቅድ የምናዘጋጅበት በመሆኑ በእቅዳችን ውስጥ እንድናካትተው በዚህ አጋጣሚ መልእክቴን ማስተላለፍ ፈልጋለሁ። ምናልባት ከሌሎች ሴክተሮችም ከጤና ሴክተር ውጭም ካሉ ሴክተሮች የመጣችሁ ተሳታፊዎች ይሄን ጉዳይ በደንብ አጥብቆ ይዞ በእቅዶቻችን ላይ ማካተት ተገቢ ይሆናል። እንግዲህ በመጨረሻ በዛሬው መድረክ የተገኛችሁ ጉዳዩ የሚመለከታችሁ ተሳታፊዎች ለጉዳዩ ትኩረት ሰጥታችሁ ስለተገኛችሁ በጣም ከልብ ላመሰግን እወዳለሁ። የዛሬው ውይይትም እንዲሳካ ድጋፍና ትብብር ላደረጋችሁ ያው የሚኒስቴር መስሪያ ቤታችን የጤና ሚኒስቴር የኢትዮጵያ ፋርማሲ ማህበርና አጋር አካላት በጣም ምስጋናዬን ለማቅረብ እወዳለሁ። አጋርነት በጣም ወሳኝ ነው። ይሄ ዘርፈ ብዙ ጉዳይ ስለሆነ የብዙ ሴክተሮች ርብርብ ስለሚጠይቅ አሁንም አጠናክረን ስራዎቻችን ላይም እንደዚህ አይነት የጋራ ትብብር ስለሚጠይቅ በዚህ ደረጃ ተባብረን እንድንሰራ ለመጠየቅ እፈልጋለሁ። እንግዲህ ይሄ ውይይት የተሳካ ውይይት እንዲሆንልን ብዙ የምንማማርበት ሀሳቦችን የምናነሳበትና የቀጣይ አቅጣጫዎች የምናስቀምጥበት እንዲሆን እመኛለሁ። ውይይቱን በይፋ መከፈቱን አበስራለሁ። በጣም አመሰግናለሁ። ኦቨር ቱ ዩ መስፍን።
እጅግ በጣም አመሰግናለሁ ወይዘሪት ሂራን። እጅግ በጣም ጠቃሚ መልእክቶችና በየአመቱም ይሄንን መርሃ ግብር የምናካሄድበት ጊዜ መስሪያ ቤታቸውም በትብብር ንቁ ተሳትፎ በማድረግና እንዲሁም ለመስራት የሚያስችሉ ስትራቴጂዎች እንደ ሀገር በመኖሩ እሱ ላይ ካፒታላይዝ ለማድረግ እና ለማገዝ የኢትዮጵያ ፋርማሲ ማህበር በየዓመቱ ይሄን መርሃ ግብር ያዘጋጃል እና ለተሰጠን መክፈቻ ንግግር እጅግ በጣም እናመሰግናለን። እንግዲህ ለሁለታችሁም እንደው እንደ ማሳሰቢያ የኢትዮጵያ ፋርማሲ ማህበር ይሄ የኮቪድ-19 ወረርሽኝ ይዞብን ከመጣው ቻሌንጅ ውስጥ ኦፖርቹኒቲዎችም አሉና ሁሉም ማህበረሰብ ማለት ይቻላል በዚህ ሰዓት ለኮቪድ የሰጠውን ትኩረት ተጠቅመን የአንቲማይክሮቢያል ሬዚስታንሱን ግንዛቤ ማስጨበጥ የበለጠ ሊሰራበት ይገባል። ለዚህ ህብረተሰቡን የበለጠ ተሳትፎ ማድረግ ይቻላል በሚል እሳቤ ነው ይሄንን ለኢትዮጵያ ፋርማሲ ማህበር እያዘጋጀ ያለው። እዚህ አሁን ቫክሲን ቢኖርም ባይደርሰንም በጠበቅነው ፍጥነት እንዲሁ ማህበረሰቡ ደግሞ ጆሮ እንዲሰጥ የምንፈልግበት ኢሹ አዲስ ኮቪድ ስትሬን ቢመጣና አሁን ገበያ ላይ የወጡ ቫክሲኖች ጥቅም ላይ የማይውሉ ቢሆኑ ምን ሊከሰት ይችላል ብሎ ዓለም ላይ ሰው እንዲያስብ ማድረግ ይቻላል። የአንቲማይክሮቢያል ሬዚስታንስ ፕሪንሲፕሉ ያ ስለሆነ እዚህ በዚህ መካከል የአድቮኬሲውንም ስራ በደንብ ለመስራት ቅንጅት ያስፈልጋል የሚል ነው። እጅግ በጣም እናመሰግናለን። Now I will proceed to, before I proceed to the presentations of the day, I would like to give a few reminder for our audience. Please use the chat box to write your questions or any of the speaker, and make sure that you stay muted till we open it for the discussion session. So the next session will be presentation. The first one is on antimicrobial stewardship program country experience, the Ethiopian country experience, I mean. This will be presented by Mr. Nekacho Degefa. He's a pharmacist and he's from Federal Ministry of Health and from Pharmaceutical and the Medical Equipment Directorate. He is currently case team coordinator for National Antimicrobial Resistance Team. Mr. Nekacho, over to you.
Thank you, Mr. Mesfin. And good morning, all. I hope you hear me. Can you hear me?
Yes, we are here.
Good. Okay. Thank you, Mr. Mesfin. Invited guests. My name is Nekacho Degefa. I'm working in the Ministry of Health in Pharmaceutical and Medical Equipment Directorate. And I'm coordinating the Antimicrobial Resistance Team, which is a national secretariat for the overall AMR prevention and containment. So our time is very short. I try to just briefly show you that what are the country efforts regarding the antimicrobial stewardship program in Ethiopia. My presentation outlines are the backgrounds, as well as the antimicrobial stewardship program implementation activities, as well as there are some challenges during the implementation process, and I will briefly show you that, and what were the lesson learned for the upcoming year so that we can expand this antimicrobial stewardship program to almost all hospitals. So as it is mentioned earlier, both by Mr. Yakov and Heran, AMR is a global international trade, so that there are so many evidences which show that AMR is both global and national trade. Unlike the other things, AMR requires a coordinated and a collaboration effort with the One Health perspective, so that the human health, the animal health, the agriculture, and the environment should participate on the prevention and containment of antimicrobial resistance. So that globally there are some projections which show that without any effort, if we didn't undertake any effort in 2015, there will be 10 million deaths per year due to AMR, where, as you can see from the slide, which is more than cancer, which is 8.2 million, road traffic accident, and other diseases, including diabetics. So that currently more than 7,000 estimated people are dying due to this, so that the largest share is taken from Southeast Asia and Sub-Saharan Africa, so that it is our concern as well as it's also a global concern. As you know, in the presence of antimicrobial resistance, we cannot achieve so many targets which is stated in our sustainable development goals, so that we need to work collaboratively, so that the animal health only cannot work, so that with the perspective of One Health approach is very important. So recognizing this, Ethiopia is coordinating efforts on antimicrobial prevention and containment with this approach. So that first we try to just devise a baseline, then we try to identify gaps, then we develop strategies, then we devise intervention plan and operational plans, then monitoring and evaluation activities. So that this is our country's approach in the AMR prevention and containment in Ethiopia. So based on this, our country in 2009, it conducted the baseline survey, and which shows this baseline survey, almost majority of the broad spectrum antibiotics show resistance, as well as the MRSA resistance level is very high, including coagulase negative, Salmonella species, S. aureus. They show incredible resistance for erythromycin, chloramphenicol. So it clearly stipulated that antimicrobial resistance is not advocated as a real challenge in our country, so that it concludes that there is an equal competition between the spread of AMR and AMR management in our countries. So based on this, Ethiopia tried to develop the national strategic framework for the prevention and containment of antimicrobial resistance in 2011, and further revise it to the national strategy, which is works from 2015 to 2001. As you can see from the slide, there are 5 strategic objectives, which include awareness raising for the professional, for the community, infection prevention, strategic alliance, and one of the important things is optimizing the use of antimicrobials by the use of antimicrobial stewardship program, so that antimicrobial stewardship program is given due emphasis on our strategy as one of the strategic objectives. So based on this, in 2019, the Ministry of Health takes the lead to coordinate AMR activity at national level, so that based on this, there is an interministerial committee, which is composed of 7 ministers, so that they can provide financial as well as the political support for the AMR prevention. There is also a AMR advisory committee. Under that, there is AMR TWG, which are 6 TWGs, which coordinates all strategic objectives, which is education and awareness, surveillance and research, IPC and hygiene, regulatory and pharmacovigilance, partnership and resource mobilization. And most importantly, there is antimicrobial stewardship TWG, which is led by the Pharmaceutical and Medical Equipment Directorate, which is found in the Ministry of Health, so that this National Antimicrobial Stewardship Technical Work Groups oversees the overall antimicrobial stewardship program implementation in the hospital, as well as it conducts regular meetings to address challenges and monitor the implementation, so that it's, in fact, it's multi-sectoral, since we have aspired to just transfer this antimicrobial stewardship program to the animal sectors, to the agriculture sectors, so that the antimicrobial stewardship program is coordinated nationally with a technical working group. So just to show you regarding the antimicrobial stewardship, our country's commitment, you know, our health sector transformation plan is recently revised, so that on the revised section of the health sector transformation plan 2, antimicrobial resistance prevention containment is one of the strategic initiatives under quality and equity. So that based on this, optimizing the use of antimicrobials and ensuring optimal prescribing, dispensing, as well as use with the coordinated efforts of antimicrobial stewardship program is clearly stipulated as a major strategic initiative. So that which shows the government commitment for expanding this antimicrobial stewardship program with to optimize the use of antimicrobials. The other thing is just revising the antimicrobial resistance prevention containment strategic plan. As I earlier said, it is almost the time period is complete, so that based on the revising, it is antimicrobial stewardship program implementation in hospitals with due emphasis. It's included as one of the strategic objectives in the revised strategic objective too, so that there are detailed activities, what can be done, what can be, what are the resources to expand this antimicrobial stewardship program, who are the collaborators who can lead, and everything are stated on our strategy, which is done by the Ministry of Agriculture, Environment Commission, and the Ministry of Health, so that a lot of stakeholders are also involved, so that our new strategy also give a due emphasis for the antimicrobial stewardship program. Furthermore, there is also a practical guide to an antimicrobial stewardship program in Ethiopia, which is previously developed by the EFD, the former FMACA, so that it shows hospitals how to implement this antimicrobial stewardship program and what are the interventions including the strategy, so that this shows that our country's commitment for the realization of antimicrobial stewardship program in different hospitals, so that optimizing the use of antimicrobials is very important. So based on this, our practical guide shows that one of the antimicrobial stewardship program, it is a coordinated strategy which is used for optimizing the patient safety and also ensuring optimal use of antimicrobials by all providers, as well as it is a main tool for us to reduce the drug resistance. So that with this goal, our guideline clearly stated that it is a coordinated strategy and it requires a multidisciplinary approach, and clearly also stating core elements of antimicrobial stewardship programs, including leadership commitment. It's, as you know, leadership commitment is very important for financial and human resource allocation and so on. Also accountability, which is assigning professionals responsible for the outcomes, also assigning experts, which are leaders responsible for the improvements of activities, also taking action, at least providing one of the recommendations or strategies for optimizing prudent use of antimicrobials in the hospital, also tracking the activities, what we done, reporting the activities, and education to the public, as well as the health professionals are very important, so that our guidelines, the practical guide program, clearly stipulate that these are the core elements of antimicrobial stewardship program with the goal of optimizing patient use, reducing drug resistance. So according to our guideline, ISP, the governance is it's under Drug and Therapeutic Committee. As you know, there are Drug and Therapeutic Committee in a majority of the hospitals, so that this antimicrobial stewardship team is responsible for the Drug and Therapeutic Committee and includes different multidisciplinary members, including infectious disease specialists, which is also can be replaced by a trained physician as a director, clinical pharmacist as a co-director, the involvement of clinical microbiologists, infection control and patient safety representatives, hospital epidemiologists, nurse departments, including the IT personnel also a member, so that they can link with the infection prevention and safety committee, as well as the quality improvement team, so that once the hospital can have a plan on drug and therapeutic committee, as part of that plan, there is a separate plan for antimicrobial stewardship team, which performs activities in the hospital to realize optimal use of antimicrobial in the hospital. So that reports comes from these hospitals to the antimicrobial resistance coordinating team, which is found at the ministry. Then this report is aggregated to the antimicrobial stewardship TWG, then to the advisory committee, so that these are the implementation arrangements, how antimicrobial stewardship team function and the governance structure. So taking this experience, Ethiopia implemented antimicrobial stewardship program as a pilot in 5 hospitals. So that these 5 hospitals are Black Lion Hospitals, Iron Hospital, Gondar Hospital, Jima Hospital, Hawassa University Hospital. So first, we provide an integrated training in collaboration with WHO, FDA, all relevant stakeholders are involved. So in this piloting process, as well as antimicrobial stewardship guideline finalization was one of the activities performed during the piloting structure, so that these hospitals are supported to develop their action plan so that they can monitor and work as some interventions when returns to their hospital. There is also on-site support was provided. So one of the success during this piloting antimicrobial stewardship in hospitals are almost a majority of the hospitals started to establish their team. Also, almost all of the pilot hospital conducted a baseline they conducted baseline survey so that they know where they are, so that some of the hospitals starts to initiate interventions based on the guidelines. So that this shows us expanding this program have a high impact on the prevention of antimicrobial resistance as well as healthcare associated infection in the hospital. So based on this, in 2019, the ministry takes the lead to coordinate the antimicrobial stewardship program so that it introduces to 30 hospitals, including 5 private hospitals. So that, as you can see, the ministry is working to expand the antimicrobial stewardship programs through phases. So in phase 1, 30 hospitals are included, in phase 2, 30 hospitals, in phase 3, 30 hospitals. So in each phase, there are 5 private hospitals are involved, so that this is not the issue of the government hospitals, it's also the issue of the private hospitals. So that one of the lessons we learned, including the private hospital, they are eager to work on this end. They show remarkable achievements. So when expanding this program into 13 hospitals, we are selecting hospitals based on the EPHI surveillance sites. So since, as early said, there is a TWG, Antimicrobial Stewardship Program, TWG. EPHI is one of these TWG members, so that EPHI is also expanding surveillance sites to generate data. So these 30 hospitals are selected, which is aligned with the EPHI surveillance data. So it makes us easy, so it makes the stewardship team easily communicate with physicians since there are data generations and so on. So the ministry is expanding to this. So based on this, in phase 1, there is a series of sensitization training that have been organized through those hospitals and stakeholders, so that there are physicians, pharmacists, infection prevention focus, and the nurses are participated on the phase 1, so that around 66 different disciplines are sensitized about the antimicrobial stewardship program, as well as training was provided. Based on this, the trained hospitals directly conducted their baseline assessment on the SP functionality. So as you can see, almost 53.3% of the established antimicrobial stewardship program, they only establish it, but they are not conducting any interventions. So that we realized that from the baseline assessment that there is an establishment of antimicrobial stewardship program, but the functionality as well as the progress not as much as, so that the ministry need to work more harder. So after that, there is a tool for antimicrobial stewardship program implementation is developed, training is provided, as well as aware customization of antibiotics in the facility specific to the essential medicine list is also provided, so that we introduce audit and feedback tool for hospitals, so that any pharmacists assigned leaders are responsible to work on this end report for us, and also use these findings for the quality improvement projects on their hospitals. And also we are going to, we are just encouraging these hospitals to generate data, so that we provide antibiotic use point prevalence survey training for antimicrobial stewardship implementing hospitals. So using the WHO methodology, so they try to generate some data regarding their antibiotic consumption as well as healthcare associated infection, and so many data are also generated. So the antimicrobial stewardship program team is using this data just to communicate the leadership as well as the prescribers, so that current it's under process for publishing. I hope you will get it, the findings. And also
you have 3 more minutes, Irnakacho.
Okay, thank you. With the due emphasis on supporting the emerging regions, we are conducting different on-site mentorship for establishment of this antimicrobial stewardship program. So as you can see from the pictures, these are when we are supporting emerging regions, just hospitals to establish antimicrobial stewardship. So that with this mentorship, there is a TOR development, action plan development, and showing some of the interventions what can be done, so that we intensively works on mentoring, especially giving focus for the emerging regions. So based on this, there are 12 region representatives. So there are 40 hospitals and 5 private hospitals are establishing this antimicrobial stewardship program. Even though their level of progress varies, some hospitals they started only paperwork, others hospital like Blackline Hospital, Gondar University Hospitals, Jimma University Hospital starts to take some of the interventions. And also we are training the AMR focal persons at regional level, so that they are responsible for expansion of the antimicrobial stewardship program. So with this process, there are so many challenges during the implementation. To mention some of them, one of them is competing priority. As you know, there are a lot of activities in hospitals, so that the management gives emphasis for other activities, so that there are so many competing priorities, which makes the antimicrobial stewardship program activities to be lag behind. Also, staff turnover, we are going to provide mass and intensive training for both the staffs and the leadership, but we found that there are high turnover, so that even handing over of activity is not that much. So that one of the challenges in the implementation process, as well as poor management support and low commitment of staff is one of the challenge. As you know, according to our antimicrobial stewardship program guideline, antimicrobial stewardship team is under the Drug and Therapeutic Committee. However, the Drug and Therapeutic Committee in most of hospitals are weak, so that it also compromises the efforts of establishing antimicrobial stewardship program, so that we plan to revise it also. Frequent stockout of different pharmaceutical laboratory agent supplies may also compromise some of the interventions which is undertaken by the antimicrobial stewardship in hospitals. As you all know, the emerging of COVID-19, in fact, it have opportunities. It compromises majority of the healthcare service, including the antimicrobial stewardship program activities. So what we learned from this journey is strengthening microbiology is very important, since data is very important. So the antimicrobial stewardship program team members easily communicate with the management as well. So strengthening, expanding this microbiology lab in collaboration with PHI is very important, as well as increasing leadership commitment to prioritize the problem, since I earlier mentioned that there are so many competing priorities. So the leadership commitment is very important, both to assign financial resources as well as human resources, so that we plan to increase the leadership commitment. Also integrating antimicrobial stewardship as a major component of patient safety and IPC strategy. Since IPC and patient safety strategy, there are two strategies. Just we try to integrate antimicrobial stewardship programs so that these efforts are collaborated to gain important findings. Also, we plan just including antimicrobial stewardship program implementation as a hospital standard measurement, so that each and every hospitals can be measured whether they are implementing antimicrobial stewardship or not. Also, financial support for antimicrobial stewardship program quality improvement project is very important. We learned that just this antimicrobial stewardship program implementing hospitals just to generate quality improvement projects so that helping these projects will move us one step forward, as well as continuous monitoring and supporting very important goals, providing training and on-site supports. Thank you. These are my presentations. Thank you.
Thank you, Mr. Ignakacho. I think you cover comprehensive information about the effect of on antimicrobial stewardship program in the nation, and you try to highlight the pace of the spread compared to the effort as a nation, and from baseline surveys to the strategic initiative that the country is going through. And the good thing is the new strategy and that the Minister of Health is put in place currently to tackle this challenge. And you also try to show us the core element of antimicrobial stewardship. And of course, the practical experience we had at some of the health facilities in the nation. So thank you very much. I think the audience have their own question. I encourage to put it in chat box. Otherwise, keep them for the discussion session. With this, I will proceed to the next speaker. The next speaker is Atwande Alamu. He's a registered chief pharmacist and registered senior public health professional. He has an extensive experience in the area of pharmacy and pharmaceutical management regulation. He has been serving in different capacity, different area like pharmaceutical establishment inspector, drug quality control and the toxicology laboratory director. He has also has been also serving as a director of the plan and the project director of the AFDA, then AFMHACA. He also served as a health regulatory advisor to the AFMHACA, formerly, currently AFDA, and currently is serving as AMR prevention and the containment advisor for AFDA, seconded by USAID, GHSA, PSA. Atwande, it's your turn. Please, would you open your video so that that would increase our interaction as well.
Good morning. I'm Wande. Am I audible?
Yes, you are audible.
Okay. I'm Wande Alamu. Thank you for Mr. Masfan for introducing me. And thank you EPA and the FDA for giving me this chance to present the role of regulatory in antimicrobial stewardship program. Can I share my slide or is it already shared by the organizers?
You can also share it if you want. I'll just unshare it. You can share it. So.
For ease of flipping over the slides, maybe may I try to share?
Please go ahead.
Okay. Did I manage to share?
Yes.
Yes, make it on slide view.
Yeah, okay. Thank you again. I have also served for about 2 terms as EPA executive for the last 2 terms in about 10 or 15 years before. Having said this, let me directly go to my, my presentation. My presentation outline will be, I have some objectives. I'll show you the basics of antimicrobial stewardship, as it has also been raised by Mr. Iznakacho and all previous speakers. Then the regulatory overview, then linking the regulatory and antimicrobial stewardship program. Where is the link? And I'll try to show the role of regulatory in antimicrobial stewardship program through the link, and our lessons from home, and I'll summarize my presentation. The objective of my presentation is to describe the link between regulatory and antimicrobial stewardship program. The second objective is to remind what we have on hand, the lessons from our country, and to synergize AMR prevention and containment efforts. Why antimicrobials are a concern? It has been discussed by previous speakers that antimicrobials were regarded as miracle drugs, and one American surgeon has been also said in those days that now we have defeated the microbes. The main actors in their use include the prescribers, the dispensers, and the patients. These factors seem simple, but very, very complex one, and these drugs are used to address from simple minor laceration to complex organ transplantation to complex medical intervention. And the determinants of antimicrobials in the community include different areas like education and knowledge, the healthcare system, the regulations, and the media. These are some of the determinants that has been described by Pan American WHO area. The basics of AMR and antimicrobial stewardship. AMR can stem from both the use and both appropriate and inappropriate use of antimicrobials, including overuse, misuse, underuse, or abuse of antimicrobials. So the global and national strategy to prevent and contain antimicrobial resistance has got about 5 priority areas or objectives, as it has been indicated by the opening speech. The first strategic objective indicated both in the global and national plan is the awareness and education, and the second is the surveillance and research. The third is infection prevention and control. What fourth is optimum use of antimicrobials in humans and animals health through effective stewardship practices. This is the area of focus for today's discussion. And the fifth is coordination, collaboration, and resource things. So antimicrobial stewardship is a strategy. It is a current set of actions which promote using antimicrobials responsibly, the guardians of antimicrobials, so that these drugs, if we handle these drugs carefully today, we'll have cure for tomorrow. Otherwise, we will be in problem, as it has been indicated by the opening speech. When we see the actors and actions in antimicrobial resistance, antimicrobial stewardship, this is extracted from reference, which is indicated in my reference section, why antimicrobial and what are antimicrobial stewardship programs. The hospital governance gets licensed or overseen by the government. Under the hospital governance, there is antimicrobial stewardship team, which interact with the prescribers in different strategies or different interventions like audit and feedback and restrictive measures like pre-authorization. Then the prescriber will address the patient through antibiotic prescribing, and the patient will take the medicines either through the hospital care through nurses, and this will be accompanied by the pharmacy department, which will be interacted by the pharmaceutical companies, and also interacted by the microbiology sections, whereby the prescriber is interacted in different forms. So these are some of the areas of the actors and actions within antimicrobial stewardship program. So in this case, when we see government, in many cases, the government is a regulator, which is represented by medicine regulatory agencies. So this is where the link originates. The basic objective or goals of the stewardship program, and also the government is protecting the safety and patient outcome, improve patient outcome and safety, reduce antimicrobial resistance and adverse drug reaction, reducing the healthcare costs. These are the basic goals of antimicrobial stewardship program. So it covers AMR, and we say antimicrobial stewardship program addresses AMR plus. So in other regard, antimicrobial stewardship program is also regarded as a quality improvement endeavor. Now let us see some basics or overview of the regulatory. Regulation is a combination of legal, administration, and technical measures that government take to ensure the safety, efficacy, and quality of medicines, as well as the relevance and accuracy of product information. So government regulates the safety, efficacy, and quality of products, as well as the relevance and accuracy of information circulating around the citizen or the professionals. So the mission of medicine national regulatory authorities is to protect and promote public health through ensuring the safety, quality, and efficacy of medicines, as well as protecting professionals and the citizen from inaccurate and biased information. So when we come to Ethiopian regulatory, we can categorize the Ethiopian food and drug regulation in 4 phases historically. We can say the imperial period and the military regime, which was guided by the pharmacy regulation 288/64, which served about more than 50 years. This was a very known regulation. Some of the articles in this regulation are active in these days too. The second era is the beginning of the federal state, whereby the health policy, the national drug policy, the health sector development plan, and the known drug administration and control authority was established in 1999 by proclamation number 176. In this era, the medicine, the definition of drug also covers both human and veterinary medicines as pesticides. This serves for about 10 years, and in 2009, the business process re-engineering study started, and until the mid of 2018, Ethiopian Food and Medicine Healthcare Administration and Control Authority was established. It brings some activities and lost others. For example, the veterinary drugs were excluded from this proclamation, 661 2009, while the food and other 4 Ps, the professional, product, practice, and premises were included in this era. Then the recent is from 2019 and to date, whereby the proclamation number 1112 2019, which is product focused, includes both food and drug, and left the other areas of health regulation. With regard to AMR, both the 661 and 1112 proclamation addresses well, and also included in the National Action Plan for Health Security. Though it is outside of the mandate of the regulatory, this National Action Plan for Health Security covers about 19 priority actions, both from health areas and outside of the health areas. In this, antimicrobial resistance is also included in the prevention dimension. It has 3 dimensions and 19 action packages. The 3 dimensions include the prevention, detection, and response. This NAFS is guided by it is launched by His Excellency the Deputy Prime Minister, and is covering different sector offices. With regard to regulatory organization, we have the headquarters with 7 branch offices and 17 ports of entry, and regional regulatory bodies. All these regulatory bodies have got their own duties and responsibilities. In general, regulatory functions perform the quality, safety, and proper use of medicines. In the regulatory, in the recent regulatory sector plan, strategic plan, there are 3 approaches: the preventative, trust-based, and risk-based. So antimicrobial stewardship is a good preventative approach for the regulatory. In preventative, what we mean, rather than chasing the breachers, it's good to teach, it's good to do preventive activities. And also in trust-based, for institutions that are trustable, it is good to trust institutions. And risk-based is prioritizing activities based on the risk. For example, antimicrobials will have greater priority than vitamins and other products. So where is the link between regulatory and antimicrobial stewardship program? Both work for protecting the citizens from untoward effects, better patient outcome, optimum use of resources like antimicrobials, reduction of adverse drug reaction and antimicrobial resistance, Both are working on these areas. And antimicrobial stewardship complies with the regulatory approach of the self-regulation and preventative approach. Both synergize each other. So we can say they are birds of the same feather. So what are the roles of the regulatory bodies in antimicrobial stewardship program? Regulatory promote and support antimicrobial stewardship program. Also, our regulatory authority coordinated the development and revision of, it is mandated also for the development and revision of essential medicine list, which is recently categorized antibiotics in aware categorization. Also develop and revise medicine list for different levels and related classification, which promote formulary restriction strategies. Formulary restriction strategy is one of the strategy in microbial stewardship program, and regulatory authorities, especially our regulatory authority, has a stake on this, and also develop guide and tools for prescribers and dispensers, like formulary, good prescribing manual, good dispensing manual, IC materials on antimicrobial stewardship programs. The other is develop revise legal tools like standards, policy, and proclamations, which is concordant with the antimicrobial stewardship program. Enforce RMU directive and other regulatory tools supporting antimicrobial stewardship program. Ensure quality of antimicrobials and microbiology laboratory supplies, which are very critical and important for the implementation of proper antimicrobial stewardship program. Regulators also take appropriate measures on those who violate the law. This is also in compliance with accountability, part of the core elements of antimicrobial stewardship program.
You have 3 more minutes.
Okay, regulators also contribute for promoting access and quality of antimicrobials in microbiology supplies. They also follow up monitoring and audit follow-up by actions, including recognition of best performance in antimicrobial stewardship programs. A few examples. The first one is the guide for antimicrobial stewardship guide. And the second one is RMU directive, which is mandatory. And the recent one, the first one is done in 2018, the middle one is in 2019, and the last one is very recent in 2020, which is under circulation now, the Ethiopian essential medicine list. So what are the lessons? We have many strengths and limitations. Having the strategy based on the baseline survey, the 5 strategic objectives that we have discussed, the collaboration are some of the strengths. We have many limitations, varying attention, momentum of attention, prioritization and commitment, collaboration, and capacity limitations are some of the limitations. So we learn from our strengths and limitations. In summary, antimicrobials, precious materials, saved millions of lives, now challenged by antimicrobial resistance. These are, they need guardian. Antimicrobial stewardship program is a guardian for antimicrobials. This is for protecting antimicrobials, thereby protecting the livelihood of mankind. Protecting the health and security of citizens is the core mandate or the role of the government. This is also the objective of antimicrobial stewardship program. In the proclamation 1112, Article 4 and 12, categorization, list revision, rational medicine use. Handling antimicrobials with care motto of the antimicrobial stewardship program and the regulatory, both are very complementary for handling antimicrobials. We have lessons. We have lessons for protecting our people, for better patient outcomes, and we have many things to do in collaboration with both the regulatory and antimicrobial stewardship program. I have used different references. Maybe we will capitalize by question and answer session. Thank you very much. Over to you, Masfin. Thank you.
Thank you very much, Tony, for finishing just on time and for very informative presentation as well. I know you have an in-depth experience on this, and anyone who have a question, I'm sure one day we'll address it very well. He tried to show us the pillars for antimicrobial resistance, prevention, the containment, the goals of antimicrobial stewardship, and the role of the national regulatory authorities in antimicrobial stewardship program, and the lesson learned so far. Thank you so much again. Without further ado, I will hand over this chance to the third, the last but not the least presenter, Professor Andy. Over to you.
Okay, let's see if I can get this on the screen. Okay. 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 Okay, so just a few words about me. I am the Director of Training at the Empower School of Health. I'm one of the co-authors of the Yellow Book, which many of you may know of, from MSH WHO, and I've been working for over 30 years in this field. I recently authored the Emergency Response COVID-19 platform for GOAN, which is the Global Outbreak Alert and Response Network for Supply Chain Preparedness. Okay. Message I want to portray today is that an essential area of antimicrobial stewardship, which is regrettably often overlooked, is supply chain. Antimicrobial stewardship really encompasses the whole area, from research and development all the way through the supply chain, regulation, manufacturing, through to prescribing, dispensing, and then patient compliance. But somehow we forget or don't put the full importance on the supply chain area in antimicrobial resistance. This has been a problem for some years, but has been particularly highlighted by the COVID-19 pandemic and its impact. In particular, the supply chain failures, especially for stockouts, then cause problems in themselves in that patients can't receive the medicines, but also it opens the supply chain to greater counterfeiting and substandard medicines, which gives rise to further antimicrobial resistance. As well as the medicines, we also have shortages of diagnostic test kits. And when we can't do proper diagnosis, we're back to syndromic management. The diagnosis is much less likely to be so reliable, and again, we increase the threat of antimicrobial resistance. The medicines supply chain already was very fragile before COVID hit, but now that COVID pandemic is with us, it's essential that we get supply chain and antimicrobial stewardship to work together. A few examples of supply chain failures driving antimicrobial resistance and the extent of that antimicrobial resistance. From the Philippines, they endured a stockout of first-line Category 1 TB medicines. That's the kits that come from stock TB, for around 1 month. The impact was estimated to be that around 10% of the patients would develop MDR TB. That's bad enough, but those patients then went on to infect others with MTR TB, a further 60 people. People who had treatment interruption, they still had TB and they went on to infect others with first-line TB. In total, from this 1 month stock out, around 600 people died. That's the impact of antimicrobial resistance. It's particularly felt on TB medicines because about 1/3 of all deaths attributed to antimicrobial resistance are from TB medicines. A category 1 TB drug kit typically costs $25 to $30. The cost of this stockout in terms of the antimicrobial resistance impact was estimated to be about $8,000 per patient, around 300 times more. And that's the effect of the impact that stockouts, supply chain failures can have on antimicrobial resistance. For HIV medicines, interruption of treatment also has a major impact. Data from Côte d'Ivoire, from the Ivory Coast, shows that they had a particular problematic period when about 11% of the patients on ARVs had interrupted treatment. And that led to around 4% of the total number of patients on ARVs dying from antimicrobial resistance effects. Stockouts have a major impact on antimicrobial resistance. Many of you will be aware of the WHO aware classification system for antibiotics. The effect of the stockout is often that patients are prescribed a suboptimal antibiotic. Instead of amoxicillin, they might get ampicillin. It will work, but it's not optimal. Also, it tends to be a broader spectrum antibiotic. Also, they get increasing tiers on the WHO awareness system. They use cephalosporins instead of simple antibiotics. And these stockouts lead to an opening in the supply chain for ingress of further substandard and falsified medicines. It's a major impact on antimicrobial stewardship when we have supply chain failures. Pre-COVID, there was a major problem with the international medicine supply in that it relied on a very few producers of the active pharmaceutical ingredients, the APIs. Although there are many manufacturers of medicines, there are very few manufacturers of the APIs, just a handful. It's already led to major problems on benzathine penicillin, which has been in short supply for over 5 years. And other antibiotics have similarly been a problem area. Manufacturers are reluctant to address antibiotic manufacturing for simple antibiotics because there's no profit in it. They don't make much money. Before January 2020, I wonder how many of you had even heard of Wuhan or Hubei province in China. Could you have ever found it on a map? And yet it's a major center of API manufacturing. Around 40 major APIs are manufactured in Wuhan. So when Wuhan became the center of the COVID-19 outbreak, manufacturing ceased. People talk about India as being the pharmacy of the world, and it is. But India gets about 70% of its APIs from China. And just where in China do they come from? Hubei province and Wuhan. Ethiopia has its own manufacturing industry, but so far not for APIs. It imports the APIs, and again, largely from China. COVID disrupted that whole API supply chain. The impact on manufacturing is large. Lots of reports of out of stocks of many items. Even oral contraceptives are reported as being in short supply in some parts of the world. The impact on manufacturing was huge. Even simple items. You can't print the labels for the bottles because the printer can't get the staff to work because they're in lockdown for COVID. Many unexpected activities leading to short supply of medicines. If we look at how the Global Fund assesses the situation for HIV, TB, and malaria medicines, they're currently saying delays of around 30 days on around 25% of orders. It's the latest forecast from April, May 2021. Unrelated items like long-lasting insecticide nets for malaria also under delays, and diagnostic kits. And remember the impact of the diagnostics. Short supply on diagnostics leads to irrational prescribing. If we look at the detailed situation on HIV, TB, and malaria medicines, we see that last year, in the middle of last year, in the high risk category, now generally in the medium risk category for stockouts, but HIV starting to rise again over the last few months. In preventing HIV drug resistance, the target is that only 15% of countries in Africa will be out of stock by 2023. 15% is still a large amount of countries out of stock, interrupted treatment, a lot of AMR. And that's why supply chain and AMS really must work together to mitigate the impact of supply chain failures. The recent report just out in the last 10 days on how to mitigate the impact of shortages of medicines is shown on the screen. You will be given the slide deck and can access all the URLs, all the internet links there. We see from central medical stores across Africa, around 17 medicines in short supplies, and the price of API has risen by about 30%. We can expect that to translate into increased medicine prices very shortly. Generally, when medicine prices rise sharply, we get out of stocks, we get shortages of supply again. If we look at the particular shortages, on the left of the screen, you can see the reports from central medical stores in Africa with the short stock items, betamethasone, mifepristone along there, and on the right, you can see the calculated risk factors for various items in the current pandemic situation. So completely unrelated to COVID, items like vitamin A, doxycycline, are predicted to be in short supply in the near future. How can we mitigate? How can we help to reduce the impact? The first one is to revitalize antimicrobial stewardship programs, to monitor regularly and to try to integrate antimicrobial stewardship with procurement supply chain management functions. They really must go together and work well together, and increase surveillance for substandard and falsified medicines. We've already heard about risk management techniques. Yes, we must embrace risk management techniques, particularly for PSM preparedness and risk assessment of medicine out of stocks, seeking to increase resilience, increase buffer stocks, increase lead times, increase order processing times, flexibility in volumes and values and timings of orders, seek to improve data use and resilience, and try to aggregate demand rather than place orders for small quantities, localizing supply and national stock contingencies, looking at locating buffer stock in strategic areas. Well, that's all very good, but that's really all for the central level. That's for the people at the Ministry of Health. What can I do as an individual dispensing pharmacist? How does it affect me? And what's my role in this supply chain antimicrobial stewardship? I think the first one is to recognize that supply chain and antimicrobial stewardship are interlinked. They're completely intertwined and they have to work together. Neither can work effectively without the other. AMS is important. It really does save money. It really does save lives. It is not some academic pharmaceutical concept. It's real on the ground working. Stockouts cost lives and money, and we have to try and develop the supply chain to reduce the potential for stockouts, to undertake effective risk management, increase buffer stocks, be aware of the price rises that are coming, be aware erratic supply is likely on the international market, try to protect and mitigate against that so we don't get the stockouts. Increase surveillance for falsified and substandard medicines. If we don't adopt the whole of the medicine chain, from research and development through to patient compliance, and particularly include supply chain, we can't have effective antimicrobial stewardship. For those that would like to learn more about COVID-19 and the supply chain and its impact, there are free online training courses available from GOAN, that's the Global Outbreak Response and Alert Network. Link is on the screen. Different areas are there. It's easy to look at those. One particular area, again, for antimicrobial resistance is waste management, making sure we dispose of medicines so they don't impact the environment, they don't lead to antimicrobial resistance in the environment. Thank you very much. I've tried to complete on time. I now hand you back for the Q&A session.
Thank you, Professor Andy, very, very much. And of course, we pharmacists in Ethiopia now use your yellow book, including myself, during my PG training. And I'm very happy to see you in person and have this interesting presentation from this wisdom over the last 30+ years. You really highlighted the cost of supply chain interruption in association with antimicrobial resistance and the country's experience, and how different actors, including dispensing pharmacists, contributed to that. So without further ado, I give a chance for all the audience to raise their hand and ask a question for all panelists. It's time for discussion. Anyone who have a question, please raise your hand, then I will give you a chance.
Mr. Mesafin, I can see that someone has already put in the question on the chat box.
Okay, would you read it for us so that anyone can respond to it?
Sure. Let me just take it one by one.
Okay. Sanya, would you?
Masfin, can I get in?
Okay, go ahead, Mr. Zod.
In the chat box, Dargecho gave a comment. It is a comment. The comment is for me. Can I respond, or shall I read for the audience so that they will have some idea about the comment?
Go ahead, Wendy.
I prefer multidisciplinary regulatory approach was better than product-focused regulatory system, FDA, for AMR prevention and control, because the risk factors, actors for AMR are multidisciplinary as well as multi-sectoral. This is a comment. Just to react the comment for the comment. Thank you for the comment, Dargecho, first of all. And there are people like you who support this, and there are people who want to cascade further. For example, rather than regulating both food and drug together, because both these items are diverse activities, so it's better to separate the food and drug further. And others they argue capitalize on separating the food and drug and including the drug area, bringing the veterinary medicine from agriculture and regulating under one regulatory authority. So these are options. This has to be supported by different studies, but having extended mandate like FDA, which is regulating 4 Ps, the product, premises, professionals, and practice. People argue that this is a very huge mandate. You will lose focus if you want to regulate many. So these are many and huge tasks which has to be separated. Dargecho added, I can't reach most of the program presentation and this is not for me. So there are different opinions. I'll see this opinion, and since the world is dynamic, still things will be moving, but let's exercise first and see the outcome. With regard to antimicrobial resistance, the governance part has sent to the mother organization, Ministry of Health, and still FDA will contribute within its own mandate. So I don't think having the 4 Ps, continuing with 4 Ps will bring more attention for antimicrobial resistance. Dealing with the product focus will give more emphasis for antimicrobial. This is my opinion, but we can argue there may be different platforms for having such discussions, but opinions will continue while FDA will exercise in product-focused approach. Let's see the outcome, let's see our progress, and then we'll see where to focus. Thank you, Dargecho.
Thank you, Mr. Wande. I think Mr. Dargecho is from South Nation, the Nationality Regional Health Bureau. He's a focal person for antimicrobial resistance. He told us he faced the challenge in attending some of the session due to connectivity. And thank you, Sonia. You showed where you can get the full record of that this session. He also asked about if anyone has a national study or finding on antimicrobial resistance, antimicrobial use and AMR in the era of COVID-19. So anyone who have such type of study can share with him. He dropped his email with us, so we can share with him if you share it with us. Any other question? I have seen Mr. Zodi Zema has raised his hand. Please unmute yourself and continue with your question. Zodi.
Okay, thank you. I'm Zodi from Walaita Sodo University. I'm Gilgar Harris, lately joined. Actually, I posted my question on the chat section. My question is, we had policies, procedures, guidelines long ago to containment of antimicrobial resistance, but I don't see actually true intervention in most of the healthcare setting. The sale for this problem is a healthcare setting and the community, but there are actions or theory there and here ongoing. We done many conferences. Yearly there are the celebration of Antimicrobial Resistance Day, but year to year there is nothing that's happening in hospitals. My question is, why it is underlooked at the government level, and who is responsible and accountable for not having this kind of intervention in hospitals. And if some a hospital or healthcare setting want to establish it, what the procedure and who is accountable and responsible for the establishment of such kind of activity. As your report I have seen, there is no hospital in the southern nation and nationals. I saw zero implementation in especially southern region. Why is happening? Why it's underlooked? That's my question. Thank you.
Thank you, Mr. Zodi. I think this question goes to Mr. Ilnakacho. Would you respond to it?
Okay, thank you, Zodi, for your question as well as comments. Before just mentioning the answer for Zodi, just Dargicho needs where are the findings regarding antimicrobial resistance, just to inform him. He can get yearly surveillance data from EPHI websites, so that at least 7 hospitals findings in each year are going to be released, so that he can get the information from the EPHI websites. Regarding Zaure's question, in fact, he mentioned there are some efforts, but there are no true interventions in the hospital, and why it's underlooked at a government level. I think, as earlier I mentioned, the functionality of the antimicrobial stewardship program varies from hospital to hospitals. As you can say, some of the hospitals have only on paperwork, and some of the hospitals started the intervention. But for me, at the government level, there are commitments. For example, who is responsible to implement this activity at the hospital level? It's not the government. The responsible person is the management, the professionals. What's expected from the government is just to show the way, to provide guidelines, just to sensitize the issue, so that these hospitals can take the lead to implement the activity, and so that we are not going to expect antimicrobial stewardship program to be implemented by the government on that hospital. So that I think the most important thing we all need to aware is we all are responsible for the implementation of antimicrobial stewardship program. For example, if there are no hospitals implementing the antimicrobial stewardship program in southern nation, I think there are hospitals, for example, Hawassa University Hospital, we provide training for them. They are going to sensitize their managements. I think they are on the right track, as well as the Walaita Sodo University Hospital, which is a special hospital, which established antimicrobial stewardship program director. It is the first in our country, right, who established antimicrobial stewardship program at the director level, so that the management of the university hospital accepted that it should be coordinated by the director, so that there is assigned director to coordinate these things. So the most important things for me, the government show its commitment. The best example is just to mention it. It is our health sector transformation plan. It's part of our health sector transformation plan, so that each of us, each of hospital managements, each of health professionals which work in the hospital should be responsible for the implementation of this activity, so that, as previously mentioned, there is no single best intervention for antimicrobial resistance, so that each of us needs to coordinate our efforts, so that I think for me, I feel that most of the works on the prevention of antimicrobial resistance, prevention, containment is going to be done at a higher level, so that there are paperwork, it's stipulated in the strategy, it is stipulated in the HSTP, and so on. It's provided supporters, trainings, and so on. But the hospital management, those who gain the training, should be responsible to implement that things in a hospital. After all, with prudent use of antimicrobials, by increasing their patient satisfaction and so on, the facility is itself is the one who get the importance from this stewardship practice. So that I think whose responsibility, one of your question, it's all of it's hospital management's responsibility, health professionals' responsibility, and so on. But the government is trying to coordinate this activity at the national level by providing legal documents, legal backgrounds, guidelines, and so on. And also we are providing some financial grant seats for hospitals just to provide some point prevalence survey and so on. So that, in fact, it is not as expected, but it's all our responsibility to implement these things. Over to you, the virtual podium, Dr. Masfin.
Thank you, Mr. Nakacho. Any other question from the audience? I haven't seen any hand and any question in the chat box. I have a question actually for Professor Handy. We have seen that there is an increment, an alarming increment in pharmaceutical costs globally following the outbreak of COVID-19. Actually, what justifies that besides the shortage in API?
It's the case of shortage. API is in very short supply. The pharmaceutical manufacturers are outbidding each other to get the little supply there is. There's no justification for it. It is market dynamics. Because so little is available, each of the major manufacturers is outbidding each other to get the API from China. Also, there are limited transport routes. Much of the medicine traveled by passenger aircraft as cargo. Those passenger flights are not traveling. So it's harder to ship it, it's harder to move it, and freight rates have increased markedly. So it's the combination of short supply and increased freight transport costs.
Thank you so much. Following that, do we expect a kind of decrease in the near future, or it may last for a while? What is your suggestion?
It's very difficult to predict because it depends largely on the activities around the COVID pandemic. If India is in lockdown, that's the major manufacturing center, then the price will remain high. If India can open up fully, then it's likely to fall back down again. We don't see this as a permanent increase. It's caused by the pandemic disrupting. Freight rates are likely to remain a little high for at least another year, I suspect. So probably another 1 to 2 years will be the best estimate.
Thank you so much. I haven't seen any other question. We are left with 10 more minutes to conclude this session. If anyone has a question, it's your chance.
Okay, Masfin.
Okay,
Zaude also raised that important question. It says if the hospital is not giving the antenatal care, then the management is accountable. But why not for implementing antimicrobial stewardship program? I think Zaude, you raised the most important question. As you know, we are just working on this. As I earlier mentioned, that we are going to include the antimicrobial stewardship program implementation as one of the performance measure of the hospitals, and also including this antimicrobial stewardship program as one of the standard in the pharmacy service area, so that we start to communicate with the relevant stakeholders, which is found in the ministry. So that I think currently we will include this antimicrobial stewardship program implementation as one of the areas to be included in service, in the pharmacy service, so that this pharmacy service implementation guide also includes as one of the criteria out of the 12 criteria. Also, just we are trying to include the percentage of antibiotic prescribed, one of the DHIs to reporting indicator, so that each and every hospitals, which is, as well as health centers, which is found in Ethiopia, are expected to report this percentage of antibiotics prescribed as one of the proxy indicator for the AMR in quarterly basis, so that the management will get the issue, at least it is important for these decisions are very important to the high level. So they are expecting themselves to engage on promoting prudent use of antimicrobial so that we are on the progress of these areas. Thank you.
Thank you, Mr. Nakacha. That's great. You follow up with the chat box and responded to the question. And I admire that this initiative should take us forward in improving our effort towards antimicrobial stewardship. So I haven't seen any more questions in the hand, so let's conclude this session from our side. The first one from the lesson we had today is that, you know, some of us mentioned that unless otherwise we act it now, we may suffer more from its impact. And we often mention that if the pace of antimicrobial resistance is development of antimicrobial resistance is in such a manner, it may soon take us to the pre-antibiotic era. Always, I have seen this prediction, and most probably it may not be something that we can conceptualize. Rather, my intention is it's good to associate with the COVID pandemic situation in which we passed through for the last 1 year, so that we were out of any pharmaceutical solution for about a year, and this situation is more understandable than the pre-antibiotic era. So it's good to associate and use this as an opportunity to promote antimicrobial stewardship. The other one is we all have, as a nation, we have put an effort, and we put all those strategies, guidelines that helps us to contain and prevent the further spread of resistance strain and containment of this. So we have to have go beyond the health sector, as you mentioned. One health approach is putting clearly that there should be a multi-sectoral effort in order to mitigate this challenge, this global public health problem. In our context, you know, Ministry of Health has gone far in putting strategies, guidelines, and there is an effort to use different structure of the ministry to contribute to this. However, for example, unless otherwise, we are closely working with veterinary aspect, we may not succeed or as we want in this effort. So we have to work in a multi-sectoral approach to get the result we want from this effort as well. So besides the effort in Ministry of Health, there should be more advocacy and consultative session in order to realize the motto of One Health approach as well. This is a message I had. Thank you very much, all the audiences, for joining us on our today's session. Hopefully, we'll continue working on this in collaboration of all national and international stakeholders to strengthen our effort. Thank you so much.
Thank you very much. Have a good day.
Okay. Goodbye.
Bye to all.